All right, so this is kind of a controversial topic, but I think it's important to address because a lot of people come to me and they're like, not that I'm perfect, but I try. And so I try to be empathetic, understand like what someone's life is like and what they're going through, because life as it is has a lot of challenges. But I wanted to provide you some information that I have gotten, and it's also subjective too, because it can be shifting. So, in 2026, the research um, in the field of personality profiles in the medical profession, so what type of doctor you are. Now, this is not all doctors, but this is a general consensus. It highlights a distinct divide between technical and procedural fields and human-centered, patient-oriented ones. So, um, most doctors that are narcissistic, from what it's been defined in literature, are surgeons. They um, score the highest in terms of narcissistic traits because one thing, they don't really have a connection with the patient, and they just kind of explain things and what the procedure will be, but they don't really understand what pain is causing. Um, but I've met many surgeons that are also very empathetic, but they have certain traits that are different. Um, so vascular surgeon is ranked first in narcissism and other traits, and other fields like gastroenterology, orthopedic surgery. Um, they make you wait. Not always, but like I said, this is not cold hard facts, but these are trends. Um, and so the most empathetic doctors are general medicine, but again, this is kind of like really based on each individual because you may come across some doctors that are in general medicine that aren't empathetic. They just go down a checklist, which I've had experience with that, but other fields of high empathy are psychiatry, pediatrics, dermatology, and OBGYN. So, because really it involves like you talking to the person and having that constant interaction face to face. So this is what I think is interesting in psychiatry that I've noticed is back in the days when people were psychiatrists, they had no access to medicine, so they were psychoanalysts like Jung, or I don't really like Freud, but there's others as well that used to kind of look at people in asylums and try to understand like what is their core belief, like why do they keep talking about these things, because they didn't have access to medicine. So over about I would say like 80 to 100 years, the shift in patient experience that I was describing, patients often feel unheard, and I completely understand that because I see secondary opinions, and often it's that they're over medicated. Like, I went to a psychoanalytic training program, so I know how to be a therapist. I know how to understand what you could treat with medicines or supplements or therapy that need to be addressed. So, uh, biomedical reframing. So, psychiatrists shifted from a mind oriented approach with psychoanalysis, talk therapy. So, then that's been sent out to therapists or psychologists, which is a variable within itself. Many people have had good and bad experiences. To a brain oriented medical model. Modern psychiatrists often trained as prescribers. So I don't really like when people are like, oh, I just want this medicine, because there's a lot more to someone's mind than just taking medicine. And medicine is not always the best for everyone. So that's why I offer like a variety of treatments. Symptom checklists rather than understanding. So I use checklists to get data, but I interview a person from scratch because I don't really cut corners, because I think, to someone going 1 year trying to progress versus if I can address the issue faster in 3 months, that's the most important thing. Um, so there's a pressure in healthcare costs that many systems limit a psychiatry visit to um, basically 15 to 20 minutes. And so that's why I'm in private practice, because I like to cater to each person. And, a lot of my patients understand if I go over. I don't intentionally mean to do it, but sometimes there's complicated situations. Many psychiatrists face high burnout from heavy patient load, or dismissive and arrogant behavior, maybe a defense mechanism. So I think of myself just like any person that I would want the same respect. And when I do show up late, I do apologize. I think that's basically a good a good way of portraying who you are. I try to be myself, and I want them to be themselves. So power asymmetry, which I don't like. Is very important. Um, so so basically there's an unequal power relationship with doctor's opinion as a final authority, and I don't actually have that same mentality. I ask the patient, well, what do you think about this, or what do you think about that, and we brainstorm a better idea, because that's their life and I'm not in their shoes, right? Um, so I think that's the different approach I always take is I try to make it collaborative, which I don't think a lot of psychiatrists do. They just um, they just want the person to take what they say, which I think is very weak. And I think each person should be very, very vigilant about. Um, so, couple factors are if you avoid a doctor if they dismiss your symptoms repeatedly, and or if they gaslight you, meaning it's all in your head. Uh, it should be because it's your brain, right? Or refusal to answer questions, humiliation or shaming. Now, healthy professional dynamics or respectful communication, clear explanations, shared decision making, willingness to answer questions, and transparency about limits. Like this medicine can't help this problem.